All right. Hi, folks. I'm Kelly O'Brien. I'm the Director of Customer Success here at Arcadia. I've been with the company going on 8 years now. And that means I've seen a lot of clients go live. And I have looked at the clients that have been successful and really tried to figure out what made those particular clients more successful from other clients. I'm going to share that with you today. So, tips for success after go live, really breaking it down into 4 different pieces. The first is identifying and executing on a really defined set of goals. Second is you need an ongoing data management plan. The third is establish a user management and support model up front before you go live. And then finally, get really immersed in the tool, really understand the functionality. So defining your goals, we kind of have 2 spectrums of clients. You have your clients that go live, and that's their only goal, right? We just want to get live. They're on the far end of the spectrum. They haven't really thought about what's our next step after we go live. And then we have our other clients on the other end of the spectrum that say, we're live, we want to do everything. We want to use Vista, Bindery, Foundry. We want to use the entire Arcadia product suite in the first 2 weeks that we go live. Neither one of those is super realistic, right? Clients that have been the most successful find a middle ground. So figuring out for your organization, what are your primary needs right up front, and really defining what are the incremental goals to get there. No 2 organizations are going to be the same. Different organizations are going to have different goals, of course. But what you can do is figure out for your needs, what are the incremental steps? Are those steps that can be visible across your organization? It'd be great if you could have some small, quick wins that then you can share across your org, develop some excitement, develop some trust and adoption that way. And what's also really important to keep in mind is really narrowing down on, I'm not just saying, hey, quality is my goal, but specifically, I want to start with maybe our P for P measures, and we have 3 measures that are low performing. We know we don't do great on them. We're going to start with those 3 measures, and we're going to do a gap outreach, right? So you've identified who, what, where, how. You've really gotten it down to kind of a science of how you're going to roll this out. So being very specific with those goals is going to help you achieve success. And then also, again, creating a plan towards meeting those goals. And then the last bit here is if anybody here in the audience is actually tasked with rolling out a data analytics software like Arcadia, I really don't envy you. You're probably getting asked from a ton of different stakeholders, and they're all saying, hey, we want to use Arcadia for this, and we want to use Arcadia for that. And you're in the middle trying to figure out what should we focus on. So keeping your own internal stakeholders aligned on these are our first set of priorities is really helpful. All right, second up, we have our data management plan. Folks that have worked with data, once we get it integrated, the fun doesn't stop, right? So it takes time to integrate data. And then once it's integrated, it's still changing. It's always going to be evolving. If you've worked with plan data, the payer is going to send you an email in a few months and say, hey, our format changed, right? So you're going to have to make some adjustments to continue to ingress and digest that data. Or if it's on the EHR side, you might be going through migrations to other EHR systems, you might have new workflows. So regardless, you have to plan for having support on your data after go live. Having an expert, right? So somebody who really understands your feeds, they know the schedules for those feeds. They are your point person. They can tell internal resources how lagged your data is or isn't just by nature. Some data is going to be more lagged than others. Is really helpful for your own internal teammates. And then Arcadia, so we're going to partner with that person. That's going to be our counterpart. And we supply our clients with a couple different resources to support data management and data monitoring. The first, we have a visual of one of our data monitoring daily emails that goes out. This is really helpful. A quick glance, are all my sources getting loaded on the right timing? Yes, no. But we're taking it one step further, and later this year, we're releasing a new tool that allows you to really drill down into every data source, see every file that's ever been sent, and its status in terms of processed or not processed. That's going to really enable our data SME from the client side. All right. Our third key factor is developing an end user and support model. So once you go live on Arcadia, you're going to get introduced to Arcadia's production support. Those are the folks that are going to help you work through any issues you have, right? Traditional support model. But what we're recommending here is a centralized system. So you might be working with, I don't know, 15 different provider groups, a few health plans. So delegating somebody as the centralized intermediary so that they're taking in those issues and then reporting them to Arcadia can be really helpful. The first part is it's going to allow them to gather knowledge on where the knowledge gaps are across your end users. And the second, it's going to bring a lot of awareness to what are the issues that we're seeing and what do we want to prioritize with Arcadia's customer success team. So that's the second team you'll get introduced to. That's the CSM team that I run, and they will help you with the technical project management side of resolving those issues. Additionally, you're going to want to continue to keep internal stakeholders aligned on priorities. So it's sort of a reoccurring theme here. And then when you get into user management, there's sort of two key things to think about. One is you're probably going to have turnover. So new people joining your organization, how are you going to onboard them? And the second is what access should your users have? That's both to functionality and to PHI. So I had a client that was, right out the gate, they already had an SLA around this is the access we give out, depending on the user type, which is really helpful for them. It required very little thought on the person managing it, and then also reduced any sort of risk towards inadvertently giving PHI access out to folks that really shouldn't have it, right? And then the last part is getting really knowledgeable about Arcadia. So we're going to do a lot of super user training with you when you go live. It's all going to be very new to you. You're probably going to retain, let's say, 60% of it. So there is some more you can do to gain that understanding. Part of that could be going into the tools and actually following Arcadia's user guides, doing them step by step and learning. It could be just writing down, I have a list of 10 questions. I want to try to answer those questions with Arcadia and sort of testing your own knowledge. But there's two, again, things that I see clients do time and again that set them apart. One of them is documenting use cases so that they can say, for this user group, these are the use cases you're going to follow. This is the exact workflow, step by step to follow. And then the second part is really knowing how their own data operates within the functionality. So if, for example, you don't have appointment data, then okay, well, that's going to limit some of our workflows around care coordination. So understanding how the data that you have might interact with Arcadia functionality. And then the other key piece here is Arcadia, we offer 6 different attribution models, and you might choose to use 1 or 2 or 3, but really knowing what time and place to use which one could really make some dramatic differences, as you can imagine, because your panels may be very significantly different if you're using the wrong one. And then 2 other resources we have, again, for folks trying to learn about Arcadia, who've been through that super user training or getting onboarded, would be our LMS tool. So we have pre-recorded videos across our entire product suite, super helpful. Again, the hearing information for the second, third time really helps you digest it. And then third is ARC Questions. So ARC Questions was rolled out last year, and it's a communal place for all our clients to submit any questions they have and receive responses in the next 3 to 7 days. So it's really quickly responded to, which is nice. So those are the main 4 factors that I see clients adopt who are the most successful with a data analytics go live. We'd love to turn it over to the audience and see if there's any questions. Yeah, so the question was, how do you triage your priorities at work with certain stakeholders? So I think the first is having a really good understanding at an organizational level. What are you trying to accomplish as a business? And then letting that inform what are the next priorities to achieve that goal. So if you don't have that at the highest level, it's going to be really hard to manage downstream. Yeah.
So you mentioned that the most successful instances of Go Live were a sort of hybrid between we just want to get online and we want to use every tool available immediately. Can you give some examples of what that might look like in practice?
Yeah. So, in terms of finding that middle ground, I think that's kind of what you're asking. Yeah. So, again, gets back to for that organization what their specific goals and needs are. So, if you're an organization that's focused really heavily on quality, then that's probably where you should start. But you should figure out, and again, it's going to vary from organization to organization. Do we want to start with a point of care solution? Do we want to start more on the analytics side and just get comfortable with Arcadia measures? That's probably a better place to start. See how we're performing before we start then rolling out point of care workflows. But I would say that middle ground, it really is going to vary from client to client based off of their particular needs.
So maybe this is just driving the point home that we're already talking about. But say you have an overambitious client that has 15 goals, and it's like you need to narrow that down. What advice do you give them to make sure they're picking the right goals first?
Yeah, great question. So typically we would look at what data you have integrated. So that's a really big driving factor. So if you have 15 different goals you want to accomplish, and we're already like, hey, that's a lot, you're being very ambitious. Uh, One of the pieces you want to consider is, well, hey, wait a minute. 10 of those goals are dependent upon data that you don't have access to yet. So let's focus on those first five and create a phased approach for adoption and for rolling out use cases so that you are actually getting the value. Otherwise, you're rolling out some use cases that maybe don't have the greatest value add yet. And that could really diminish trust in the system. So I think it's more a matter of looking at what have we implemented, what is our plan for implementing the rest of it before finalizing what your first set of goals are going to be. All right. Well, I appreciate all the questions and thank you for coming to listen today.